Asthma is a disease in which the airways become so narrow that it is difficult to breathe either temporarily or permanently. Asthma causes recurring periods of wheezing, a whistling sound when you breathe, chest tightness, shortness of breath, and coughing. Coughing often occurs at night or early in the morning. Asthma can develop at any age, but it often first occurs in childhood or teenage years. Among children, boys tend to have more asthma than girls, but among adults, the disease affects men and women equally. According to World Health Organization, in India, 15 to 20 million people suffer from asthma, while a rough estimate indicates out of these 10 to 15% are between age group of 5 to 10 years. To understand asthma, it helps to know how the airways work. The airways are the tubes that carry air into and out of your lungs. People who have asthma have inflamed airways and react strongly to certain inhaled substances. When the airways react, the muscle around them tighten, narrowing the airways, causing less air to flow into the lungs. This swelling can also worsen, making the airways even narrower and difficult to breathe. The exact cause of asthma is not known. Researchers think some genetic and environmental factors interact to cause asthma. Asthma is more common in some families than in others, which suggests that gene might have a role to play. Asthma can be inherited from parents, making the airways more reactive to substances in the air. Research also suggests that genes interact with environmental factors to worsen the asthma symptoms. These can be allergens from insects such as cockroaches, animal fur. Viruses can also cause asthma symptoms. Pollens from trees, grasses, and the flowers. Irritants such as cigarette smoke, the air pollution, pollution from the car, or even the chulha smoke. Some compounds in the home decor products or sprays such as hairsprays or any chemical or dust from the workplace or the house can cause asthma. With the potential causes known, let's get on to who is at risk for asthma. Children have a high risk of developing asthma compared to adults. Children or adults who have frequent respiratory infections such as cold and cough. Also those who are more prone to have allergies, eczema or any other allergic skin conditions. Primarily, doctors usually diagnose asthma based on your medical and family histories, also by a detailed physical examination, a general health checkup and the type of symptoms you show. Sometimes they may also perform other tests such as an X-ray, an electrocardiogram, or any allergy test to rule out other diseases. Sometimes doctors may also perform a lung function test by spirometry to check how your lungs are functioning. This test measures how much air you can breathe in and breathe out. It also measures how fast you can blow the air out. Asthma is a long-term disease with no cure. The goal of asthma is to control the disease. The first and the foremost control is to prevent or avoid allergens which causes the symptoms. This can be done if you keep a track of your symptoms. And also, you should always carry your inhalers for quick relief. Apart from these, doctors prescribe few medicine based on your symptoms which help in opening up your airways. These are short-acting beta-2 agonist which serve as a quick relief medicine, long-acting beta-2 agonist if quick relief do not reduce the symptoms, and steroids for long-term control of the disease which help in preventing the symptoms. It often takes time to learn to live with a chronic disease, but the right kind of information and disease management, emergencies such as hospitalization can be prevented.